Hey, why are we being bombarded with drug ads every time we turn on the TV when in nearly every other country it's illegal? Why are Americans paying more for prescriptions than anyone else and still ranking among the sickest in the developed world? What if I told you only one other country on earth allows this? And it all started in 1997. Take a listen to Robert F. Kennedy Jr. on what's really happening.
Now, I would look at actually getting rid of the pharmaceutical advertisements on television. Prior to 1997, they were not on television. And there's only two countries in the world that are where pharmaceutical companies can do direct-to-consumer advertising on TV. And one is New Zealand, the other is the United States. And
Wow.
we're paying much more for drugs than anybody else. We take many more of them than anybody else in the world. We spend twice on healthcare as people spend in Europe, and we have the worst health outcomes in the world. We're 79th in the world after Costa Rica, Nicaragua, Mongolia, Cuba. We have worse health outcomes in this country than any place, and we have to change something.
So that's Robert F. Kennedy Jr. laying it out. The U.S. is one of the only two countries that allows drug companies to advertise prescription meds directly to consumers on TV. The reality is this: these drug companies are not healthcare. They are big business trying to profit off people that are suffering. Before 1997, it was illegal, but since then, things have changed a lot and not in a good way. In 1997, we were spending about $72 billion total on prescriptions. Fast forward to 2024, it's now over $400 billion. And by 2031, it's projected to be nearly $600 billion. That's more than a five-fold increase in just over 20 years. You can see the chart here on how it started spiking there around 1997. You see that hockey stick going up. So here's what's happening because of these over-advertising. We're getting over-prescriptions and over-treatment. People see these ads and they recognize a symptom and march right into their doctor and ask for that drug by the brand name. Some doctors give it to them just to keep the patients happy, but that can lead to people taking unnecessary medications, which ups the risk of side effects, interactions, and even worse. Number two, here's the thing that happens. Focus on expensive brand names. Now, here's what this does. These ads push newer patented drugs, which are always more expensive, even when cheaper generics work the same, which I don't think they should take those either in most cases, but that's what people get. But overall, people are paying a very, very high out-of-pocket cost for these premium brand names. Number three, it's misleading information. You've seen it, a family smiling in a canoe while a voice quickly whispers about lover fatigue and suicidal thoughts. But the emotional appeal of people saying, I want that family life, I want that activity, overcomes their knowing what the risks are. By the way, not all of the side effects are on the drug. Every drug depletes the body of vitamins and nutrients, and that's not even on the label. So there's so much misleading information there. And here's number four. It medicalizes normal life. You know, hey, are you sometimes tired? Are you sad sometimes? Are you struggling to focus now and then? Well, that's a disorder, right? Like ADHD, like that's a massive disorder you should take drugs for your whole life. According to these commercials, you might have a medical condition requiring a $700 a month prescription. And what it does is it pathologizes everyday life just to boost profits. Listen, sometimes you may feel down. Sometimes you might be tired. Sometimes you may have trouble focusing. But the reality is that there are also natural things, lifestyle things you can do that aren't drug related, and some of that is normal. Now, Robert F. Kennedy Jr. is one of the few people talking about banning or severely restricting direct-to-consumer drug ads, and I absolutely agree with him. He argues it's part of the reason why Americans are sicker and more medicated, even while spending more than almost any other country on earth. We spend far more than any other country. And whether you love him or not, he's right on this one. The U.S. is an outlier, and the results are in more ads equal more prescriptions, equal more spending, equals worse health outcomes. Hey, what do you think? Should these ads be banned? Should pharma companies be allowed to treat our TVs like billboards? Drop your thoughts in the comments and make sure to subscribe and hit the notification bell so you don't miss more content like this.